500 people affected by TB from across the globe. It is my honor today to welcome each one of you to this very important and significant roundtable, Ending TB by 2030. Universal access to care, multi-sectoral collaboration, and innovations to accelerate progress and combat antimicrobial resistance. TB is treatable and curable. I hope everyone knows that. Yet today, it remains one of the top killers in the world, with about 1.6 million lives lost annually. The 2018 UN high-level meeting on TB set ambitious targets and pushed progress towards ending TB and saving lives. But 2018 onwards to now, the world experienced extremely challenging times with COVID-19, which reversed years of progress, and we are just getting back to normalcy now. I would like to acknowledge the progress of member states in saving lives despite these challenges. However, there is much to be done if we are to end TB by 2030. We need better tools, robust mechanisms to roll out those tools at the ground level, equitable access, adequate financing, strengthened collaboration across sectors, especially engagement with TB-affected communities and civil society. This engagement has been remarkable under the leadership of Dr. Tedros, Director General, and Dr. Teresa, Director Global TB Program. The establishment of the Civil Society Task Force speaks to that, and inclusion in all processes of WHO is commendable. I would also like to highlight the recently launched Director General's flagship initiative, featuring new targets and an intensified focus on universal access to services, research, and development. And the joint statement that was launched just before the UNHLM multi-stakeholder hearing with the Civil Society Task Force and Director General is very significant, because this comes at a time which is a very crucial moment for negotiations of the declaration. We hope that this engagement will continue and get stronger. Today at this roundtable, we will have an opportunity to hear from countries, hear about progress and challenges, and strategies that countries have adopted towards our united goal of ending TB. We will also hear from partners about their commitment. We hope that by the end of this roundtable, we will be inspired to work harder, to work together, and ensure that those affected by TB, who I represent, who continue to suffer, will see new hope through our efforts. With that, I would now like to invite Dr. Tedros, Director General, WHO, for his opening remarks. Dr. Tedros.
Thank you, Blessed. I'm very glad to have you here, and like to use this opportunity also to thank you and your civil society colleagues for all the support in the past 5 years, 6 years now. Your Excellencies, Minister Masebo, Vice Minister Dr. Maciel, Deputy Minister Satyaji, Deputy Administrator Gwan, Executive Gawande, Executive Director Dr. Ditu, my colleagues, Dr. Hans Kluge and Dr. Teresa Kazeva, Excellencies, ministers, heads of delegation, ambassadors, dear colleagues and friends. Over the past 20 years, we have made significant progress in the fight against tuberculosis. 74 million people are now able to access TB services, but major disruptions from the COVID-19 pandemic and other global crises have reversed progress in many countries. 10.6 million people fell ill with TB in 2021, and nearly 500,000 people fell ill with drug-resistant TB, while the number of people able to access diagnosis and treatment fell. The focus of this meeting is how we can get back on track. We have new and powerful tools to combat TB, including rapid molecular tests, which reduce testing times from 3 days to less than 2 hours, and new all-oral treatment regime of drug-resistant TB that reduce treatment times from 18 months to 6 months. These are game changers for diagnosis and treatment, and both are now becoming widely available in more than 100 countries. We have a major political opportunity this year when world leaders meet in New York for the second high-level meeting on TB. WHO is calling on leaders to commit to concrete targets. One, to reach 90% of people with TB prevention and care. Second, to use the WHO-recommended rapid test as the first method of diagnosis. Third, to provide social benefits package to people with TB so they don't endure financial hardship. And fourth, to license at least one new TB vaccine. To accomplish these goals, we need to close the funding gaps for TB care and invest in research and innovation. Earlier this year, WHO also established a TB Vaccine Acceleration Council to facilitate the development, licensing, and equitable use of new TB vaccines. At the same time, we need to address the drivers of TB: poverty, malnutrition, diabetes, HIV, tobacco and alcohol use, poor living and working conditions, stigma and discrimination, and more. I created the Civil Society Task Force on TB to advise us on addressing these issues. And Blessina is a member of that task force and your recent chair, actually. I thank all partners here today for your collaboration and engagement. Only by working together can we turn the tide against this ancient killer. I thank you, and back to you, Chair.
Thank you very much, Dr. Tedros, for those really inspiring and pushing us to do better in our efforts to end TB. And we thank WHO for all their hard work in ensuring we reach that goal. I'd like to now call on Dr. Teresa Kaseva, Director, WHO Global TB Program. And Teresa, if you could please share with us the impact of the TB epidemic and the status of progress in reaching the targets that are set. Thank you.
Thank you very much, Blessy, and warm greetings to distinguished panelists, delegations, and WHO leadership in the room, Dr. Tedros, Dr. Hans Kluge, Regional Director, all the participants, full house actually, it's good to see, of this roundtable. Let me give you a quick update on the current status of the TB response, global TB response based on the data coming to WHO from more than 200 countries. I would like, first of all, to acknowledge significant efforts undertaken by the member states, by the health care providers, by the communities at the first front to provide access to life-saving TB services, and also for their engagement and hard dedicated work to combat with COVID-19. This was big and unprecedented test for all health systems and including for TB community. And we should learn these lessons that we've been disrupted, but we've also contributed as a community. And it means that all the investments in TB programs, in TB services were investments in health systems, and they should be continued. I would like to bring few highlights, again, based on the data. What happened, unfortunately, we didn't meet our NTB strategy 2020 milestones. Now we have 2025 milestones. They are even more ambitious. They mean 75% of reduction of TB death in compare with 2015, and 50% of reduction in TB incidence for the same period. Right now, our reduction is, in terms of deaths, less than 6% and only 10% reduction in TB incidence. Of course, difficult to achieve, but it's possible, and we can see on the examples of even low-income countries, high-burden countries during COVID-19 pandemic that they managed to stay on track and they managed to provide access to services and further progress. We had targets set in the first UN high-level meeting political declaration. They were 40 million supposed to be treated for 5 years, and only 26.3 were provided by treatment. We had another target of 30 million for provision of TB preventive treatment, and only 12.5 million were provided by TB preventive treatment. Also, we'd like to remind you that quarter of the world's population is infected by mycobacteria, and some of them, especially in this vulnerable situation, can have a risk of development, especially if they're living in the crowded, poor conditions, in close contacts with people with active tuberculosis. So that's why TB preventive treatment is extremely important and should not be neglected and undermined in the systems. But from the positive side, we would like to say that at least one category of those in need of TB preventive treatment, people with HIV, they've been provided, and a target of 6 million was reached for 4 years, and now today more than 10 million people were provided by TB, with HIV were provided by TB preventive treatment. We very well know that TB is driven by determinants like poverty, undernutrition, Dr. Tedros highlighted, and without addressing these determinants, it's not possible dramatically decrease TB incidence. And that's why multi-sectoral measures will be needed, and investments from different sectors beyond health sector. Now we are looking forward to the second high-level meeting, and this time we are coming up with much better tools, with significant new updates in the recommendations, which allows to provide better treatment options, shorter, more effective, and it means that uptake should happen also very fast. We are looking forward to more innovations. We are looking for the point-of-care test in the coming years. We are looking for new vaccines, and we have 16 in our pipeline, but it will require investments. We learned from COVID how with the solidarity, global solidarity, we can bring these investments, and of course, without new effective vaccines, elimination of the communicable diseases and tuberculosis is not possible. So I will stop here, and I would like to wish to all of us interactive discussion. And I think that this strategic roundtable will set the scene and also inform high-level meeting in September. Right now there is ongoing negotiations on the political declarations, and I hope that it will also inform this negotiation. Thank you very much.
Thank you very much, Teresa. Data-driven, evidence-based response is very much needed, and thank you for your comments on that. And we've heard an overview, a global overview. Let's move to the countries. We've heard of the commendable work that member states have done, and let's move to the African region now. And I'd like to invite Honorable Sylvia Masebo, Minister of Health from Zambia. And if you could, in looking forward, Zambia is among the 30 high-burden countries who maintain progress despite the impact of COVID-19 pandemic. So what are some of the lessons that we can learn from Zambia's experience in combating TB and COVID-19 that can be used to strengthen pandemic preparedness?
Thank you. Allow me to recognize you, Chairperson, and WHO Director General for this opportunity to share Zambia's perspectives around TB. Allow me to mention it to you that our TB program in Zambia was not spared initially by the effects of COVID-19 pandemic. We had, in fact, noted a decline in the TB key performance indicators in the first 3 months of reporting the first case of COVID-19 in the country. Therefore, the Ministry of Health in Zambia came up with innovative ways to sustain the gains made in TB programming. This was also done together with the HIV program. Some of the strategic interventions and innovations that were put in place include the introduction of bi-directional screening of TB and COVID at all screening points. This made sure that all patients that were screened for COVID-19 were also screened for TB and vice versa. We have in fact observed a high rate of TB pickup among those with COVID-19 and with respiratory symptoms. We also increased government investment in community outreach services using the TB mobile truck. We have some few trucks that were donated to us by donors, thanks to our partners. This brought health services closer to the people at community level. Even those who were scared to come to the health centers were also able to access TB, COVID-19, and indeed other health services that were integrated in the outreach package. We also introduced what we called a multi-month dispensation of TB drugs to our patients, which helped us to reduce on loss to follow-up and defaulting for most of our patients. Similarly, the TB preventive therapy among the HIV-infected people were aligned to the ARV multi-month dispensation. There was also introduction of TB COVID-19 weekly surveillance meetings using the virtual platform. We used to call that the TB situation room. This helped the program to be able to interact with staff at primary healthcare level and appreciate some of the challenges they were facing in service provision and provide a timely response to those challenges. We also had an introduction of a policy of maintaining essential services amidst the pandemic. Lastly, but not the least, political will coupled with good technical leadership was the major engine for us to maintain the momentum. As you may wish to know, our head of state, His Excellency, Mr. Hakainde Hichilema, has been the lead in the fight against TB, COVID-19, HIV, cholera, and many other health issues. With these strategic interventions, the country has managed to sustain a good performance in TB case identification and treatment outcomes throughout the pandemic. We also managed to mitigate most of the impacts that have been associated with the COVID-19 pandemic. In conclusion, allow me to say a number of lessons have been learned from the fight against TB during the COVID-19 pandemic. This has actually helped us to build systems that can respond to future pandemics and diseases by use of integration and innovation approach. For example, the same machines we are using for TB diagnosis are now also being used for viral load analysis in HIV patients. This is working on the principle of doing much with little resources to produce desired results. But let me just end by saying that Zambia is very proud with our COVID-19 results, because in a very short time, we're able to move our coverage from 3% to now over 90% in most of the districts of the country. So thank you to WHO and all the other partners who made it very possible for us to get where we are today. Thank you.
Thank you very much. We are also very proud of Zambia's achievement. As a TB survivor myself, when we say people-centered, you know, it's putting everything, all the machinery together to ensure that the person who's affected receives the best care possible. Thank you for sharing that. And now let's move to one of a very significant stakeholders in TB, USAID, and Dr. Atul Gawande, the Deputy Administrator for USAID is here. And if you could share with us, you know, being the largest bilateral donor on TB efforts worldwide, you know, your work and your priorities in USAID in countries in delivering TB services through primary health care. How does that look, and how is that being linked to other health services at the country level? You know, other determinants as well. And how can countries and donors step up investment that is equitable, and you know, the rollout is equitable, and the breakthrough in the innovations. So basically, I know it's a long question, but if you could just share with us some of those highlights. And just to reiterate, you'll have 5 minutes for that. And when there's 2 minutes left, there'll be a flag that is going up. Thank you very much, Dr. Gawande.
Honored and delighted to be here. Thank you so much for the invitation to join this panel. To put it in context, the way we see it in the United States is that, as you have said, we are far off track. We have long been dedicated to work in this field, but this is still the biggest infectious disease killer in human history. It's still the #1 killer of HIV patients. It's a major killer of children. It's more than 1 billion lives claimed in human history so far. We set goals in 2018, and we've fallen far off of most of those targets. That has been a result of another deadly respiratory infectious disease in the last few years. And response to COVID crucially depended, in fact, on the progress of TB infrastructure. It was as the Minister of Health in Zambia just told us, a infrastructure of tests that were able to be applied not just to TB, but to diagnosing COVID all across the world. It's an infrastructure of people trained in respiratory illness who were able to be brought to bear on this other disease. And in many countries, it diverted from the focus on TB. We heard the demonstration in Zambia that it did not have to. And we've seen other places that managed to continue to meet goals on TB instead of falling back. Our joint efforts with partners over the last 20 years, since 2000, we have joined with others to produce in countries across the world a 40% reduction in TB deaths. We're proud of the 74 million lives saved since 2000. But our priority and strategy has to change. #1, what we see as we begin thinking about how to address where we are is we have to strengthen our local TB networks to achieve the national TB strategic plans in each country and to reach and diagnose every person who has TB, to cure those needing treatment, and to prevent spread and progression to active TB disease in those who have latent disease. That critically depends on support with local partners, with civil society organizations and as well as the governments. We have made a major focus in recent years at USAID on localization. Our investment in TB is now 40+% in local organizations. In Africa, it's 60%. And we have much further that we aim to go. That's number one. Number two, we can't get there. We can't make the progress we need to make, reach the goals and targets that we need to achieve by 2030 without research and development for new tools, and that's been a major area that we've been investing. Diagnostics has been accelerated by COVID. It's made the possibility of smaller, cheaper, easier to use diagnostics that get care closer to the patient. And that enables the primary health, the community health workers, the community health capacity to be brought to bear in ways that we've not been able to capture before. I'll give an example of one of the areas that we are now scaling up with 7 partner countries, and that is something called CAD for TB. AI, artificial intelligence assisted, computer-aided detection using portable chest x-rays can be carried in a backpack. There are many vendors out there. It's not for one or another vendor. But it has demonstrated that we can bring capacities to places where a radiologist isn't readily available. And now in 7 countries, we are rolling this out to allow screening of people to catch everybody with TB. That includes Bangladesh, the DRC, Nigeria, Kenya, the Philippines, Uganda, and Vietnam. And then when it's paired with the new diagnostic tools for molecular testing, these are small, reaching almost handheld devices, where you can do a test the same day. So the person doesn't have a long process to figure out if they have TB, multiple visits. On one visit in the same day, they can be screened and diagnosed. In Nigeria, that has contributed to a 37% increase in the number of people who are diagnosed with TB and brought under treatment in a single year, in 2021 to 2022. In therapeutics, a major innovation was, as DG Tedros said, the reduction of the number of pills and the length of treatment from 18 months to 6 months for people. But 6 months, it's still incredibly difficult. And I've seen that we are backing programs that are testing out solutions, including one that would be a single injection that could manage to provide 3 months of treatment that is under trial now. We have to be able to take this further. Finally, the vaccines. There are several in the pipeline. It's exciting to see phase 3 trials for 2 with the possibility of results within the next 2 years. We must be prepared for that moment and ready to shepherd more of these tools coming forward. All of that strengthens our ability to enable primary health care to be a central investment. TB has suffered, but all of our essential health services have suffered in the last 3 years. And the potential to have routine integration that brings it together for the first time is now upon us. We have the ability to manage HIV with a single pill per day and viral load tests twice a year, using a diagnostic system and molecular testing that can also test for TB and COVID. All of this becomes a multi-disease detection platform increasingly available to the primary health care giver at the community level.